DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. We're excited to have Dr. Justin Brown here today, and we're going to talk about certified sampling in the swine industry, something that has huge implications across all commodity groups, and Iowa State University is the first, and we'll be right back with Dr. Brown.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson, and I'm here with Dr. Justin Brown. And Dr. Brown is an assistant teaching professor here at Iowa State University's College of Veterinary Medicine in the Department of Veterinary Diagnostics and Production Animal Medicine, otherwise known as VD-PAM. You've been at Iowa State for a few years.
Yeah, since 2016.
2016. And Dr. Brown has been a part of a group and has led an initiative for certified sampling in the swine industry. And it caught my eye because so many times in the beef industry, we're like, well, we should run out and get an E-crops here. We should run out and find out what this is all about. And then we get caught up in a busy day. And next thing you know, it's 100 degrees outside and we get no samples.
Right.
And why don't you tell us a little bit about the certified sampling program for swine and kind of how it got started and why you got started?
Sure, yeah. So the Certified Swine Sample Collector Program really started back in 2018 after China broke with African Swine Fever. So there was some anxieties and fears once ASF got to China that it was going to find its way here pretty quick. So the USDA started running some drills to test the industry's preparedness to respond if ASF got here. And one gap that we identified during those drills was the lack of personnel that were trained to get out and sample pigs if in the event of a foreign animal disease outbreak. So our group here at Iowa State with the Swine Medicine Education Center and the Center for Food Security and Public Health, and Dr. Pam Zabel, who's now with Port Board at the time, was with Center for Food Security and Public Health. We put a grant together with the American Association of Swine Vets, the Multi-State Partnership for the Security and Ag, and National Port Board, and put a grant into the USDA NADPREP to say we want to fill this gap. We want to build this training program to certify individuals to be able to be called upon in the event of a FAD outbreak and go sample pigs for us. And we were fortunate enough to get that grant and worked on that through COVID years and have started rolling that training out here in the last couple of years across the country.
And I'm going to assume that in the swine industry, it's kind of like the beef industry. The sites are not all in one spot. They're scattered out. You have, corporate vets and vets that are consultants but they're not on the ground day to day in the pig building type veterinarians.
Correct. Yes, sir.
So that probably provided some utility for developing this platform as well.
Yep, absolutely. So you could trained production staff, on-farm personnel that could sample in your stead if you can't get out to that site, or if you're in a higher biosecurity site or need to be there tomorrow and not be somewhere downstream and risk that contamination. So
we don't quite have the same biosecurity stringency on our programs in the beef industry as y'all do in the swine. How many people are, you said there's like 16 states?
Yeah, as of June of this year, 16 states are actively training CSSCs within their borders. We've got 5 other that we're organizing the training because it's administered at the state level from the state veterinarian's office. And I know for Iowa specifically, there was over 100 that had been trained as of June, 100 CSSCs within the state to go out and sample pigs.
That's outstanding. It's an unbelievable program. Started right here at Iowa State University in the College of Veterinary Medicine. Sure thankful Dr. Brown will be here on the show with us. We're going to take a break. When we come back, more about certified sampling.
DNA Dialogue is brought to you by Identity Feeder, powered by Neogen.
Well, when most people purchase calves, they have a target number of days in mind, and it's usually based on incoming weight and the type of class of cattle they purchase. But there are other ways to actually try and estimate optimum days on feed. And of course, our trend is to make cattle bigger and bigger. And really that's because cost of gain in general, in other words, the cost that you're putting into that animal per day, is generally less than the cost or price you're receiving on them cattle per pound. So really, technically speaking, from an economic term, we should feed until our marginal cost, the cost for that day, equals our marginal revenue, which is obviously the price per pound. The hard part in that is knowing cost of gain on a daily basis. And there's a lot of debate about that in the industry. Many industry experts feel like the cost of gain is going up pretty dramatically at the end of the feeding period, whereas I think the data today show that actually cost of gain's fairly level, and if anything, suggests we should be making cattle bigger and bigger, which is why the trend has been to make cattle bigger. The only other thing I'd mention that's really important if you're a feedlot operator is how are you marketing the cattle. So really there's 3 general methods. Live, so on a live weight basis, one price for all the cattle based on live weight. Carcass weight basis, sometimes called dress basis, or in the beef. That's again one price on a carcass weight, or a grid, which is obviously carcass weight, but also premium and discount for yield and quality grade. I bring that up because if you're a live cattle marketer and selling cattle on a live basis, cost of gains are probably going up more dramatically at the end than if you're a dressed basis or grid-based marketing program. So how you market cattle influences optimum days on feed, but really it's about knowing your cost of gain on a daily basis.
Come on!
Angus GS powered by Neogen is the highest industry standard in genomic testing for your whole herd. Contact the American Angus Association to test today.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Justin Brown, who is an assistant teaching professor at Iowa State University's College of Veterinary Medicine, where he is in VDPAM, which is the Veterinary Diagnostic Production Animal Medicine Department, which is a huge department now.
It is, yes, sir.
I mean, when you talk about probably the #1 livestock facing, serving veterinary department in the world, I would put Iowa State's VDPAM up against anyone.
I agree.
period. And so on this certified sampling, which is just another example of your leadership, talk to me about how does a person become a certified sampler?
Sure, yeah. So the training is really geared towards those on-farm personnel, production staff. And so a Category 2 USDA accredited vet can administer the training, right? And so that might vary by state. So like in Iowa, for example, the state veterinarian here in Iowa requires us to go through Iowa's foreign animal disease training. It's about a 4-hour CE program. And then once you go through that, you can administer the CSSC training to people that want to get it. So that Category 2 accredited vet approves those individuals for training. And then the training consists of a few different parts. So the first are 3 foreign animal disease videos, really brief overview of what African swine fever, classical swine fever, and foot and mouth disease are, what clinical signs to look out for, and some steps a producer should take should they suspect that to be on their farm. Then there's some more required resources on biosecurity, sample pooling. So once we get the samples, how do you pull those together to submit them to the diagnostic lab, restraint of pigs, and also sample submission to the diagnostic lab. And then an individual can be trained to either Tier 1 or Tier 2 sample types. So we've split those out. So Tier 1 would be more of our antemortem pre-death sample types. So blood collection, oral fluids, oral swabs, nasal swabs, and processing fluids are on that. And then they could go a step further and be trained to Tier 2, which includes all of those Tier 1 sample types, but then some of those post-mortem or after-death sample types, like how to do a necropsy, how to get tonsil, spleen swabs, different lymph nodes throughout the body, or vesicular fluid. And then there's one additional sample type of tracheal swabs that they can be trained to.
So when they go through, so is the training in person then with that veterinarian, and then the veterinarian watches them do it, take it, and says, yep, they know how to do it.
Yep,
correctly.
exactly. So there's 2 portions to the training. There's an in-classroom portion where the Category 2 vet would go over the materials that we've developed for all of those sample types, which includes some short 2 to 3 minute videos and then a 1-page handout. Then there's a 25-question exam, very similar to PQA or BQA type exams. Have 3 attempts to pass that. And then they would go out into the field and demonstrate that they could effectively and efficiently collect those samples, and then they would be certified.
Yeah, and I think the relevance, you know, and we'll come back to this in the next segment, but this doesn't just have to be a foreign animal disease.
Correct. Yes, sir.
This is something that we could apply to day-to-day veterinary medicine and animal health.
Absolutely.
Perfect. It's a great program. We have a great guest today, Dr. Brown. We're going to take a break right now. We'll come right back. Thanks for watching DocTalk.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
From sunrise feeding to midnight calving, it's planning and prepping every last detail so your family can enjoy the finer things in life. It's careful feeding, impeccable breeding, and herd health protocols to keep your slice of the industry forging ahead. More than just a website or print catalog, we're a dedicated partner with everything you need, right when you need it. valleyvet.com.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
Angus GS powered by Neogen is the highest industry standard in genomic testing for your whole herd. Contact the American Angus Association to test today.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson here with Dr. Justin Brown, who is an assistant teaching professor in VDPAM at Iowa State University's College of Veterinary Medicine. And they have created a program called Certified Sampler Program for swine for foreign animal disease control, getting more boots on the ground in the trenches if something would happen. And so kind of walk us through, let's say that all of a sudden they say we have a foot and mouth disease in a pig barn, right?
Hope not. But
We hope not. And I say foot and mouth disease because that would affect our cattle guys that are watching this too. So the same thing would happen on the cattle side as the pig side. But just kind of talk us through what happens from there.
Yeah, so at that point, the state vet's office has a list of all the individuals that have been certified through the program. And then they could call upon those individuals directly or call the veterinarian that trained them that those individuals work under, and basically call up the forces, right? And say, all right, I need all these pigs or all these cows sampled within this area, and we need it done by this time point, and send them out to do it. And then those are could be considered regulatory samples, right? Because they've been trained, they're working under the vets and the state vet to collect those. And so you don't have to have a Category 2 vet or a FADD from the USDA go out to every one of those sites and collect those samples.
Cool. And so then I assume once they start from the outside and or work in, or I don't know how they do this when they set their ring of perimeter of doing this, but it's really to stop the fire from spreading in all directions far enough. I'm assuming they're taking into account for vectors and all kinds of things on how far they can sample.
Right, yeah, so they'll set that kind of perimeter around the infected premises where that site's identified as infected. And then, like you said, the idea is just kind of to corral it, right? And then they'll identify sites within that quarantine zone through epi traces or just premise identification numbers of where susceptible species are. And then it's time for individuals to go out and collect samples or do a more thorough case workup to see, are they at risk, are they infected or not, to see how far this has already spread by the time we get it identified.
I hadn't even thought about the importance of Tier 1 versus Tier 2, because in the midst of a outbreak, Tier 1 is going to be your vital and so you're not going to stop and take the time to necropsy everything, or it's getting your saliva and nasal secretion type samples,
and blood samples, right
to corral it.
Yep.
And so as we'll talk in the next segment, probably getting to that Tier 2 is probably more important for some of our endemic diseases that we're wanting to in our production systems, but and Tier 1, but pretty intense program.
Right.
You've worked with some of the producers and staff on the ground doing this. What's their response been to learning this?
I think a lot of them really like the formal training and the certification that comes with it, because honestly in the swine world, there was a lot of it going on kind of at the production staff level already, just because there's not enough vets to get out and sample all those sites at one time or when they need to. And so that they have that formal training, and now they know I'm getting the correct sample, submitting that to the lab correctly, and it helps their animals in the long run, right? By getting that diagnosis in a timely manner. So.
And I always feel like I get a little stale day to day.
Oh yeah.
And so something new that comes along that I can use my brain and get engaged and learn a little more about the animals I'm spending my time with every day, kind of gets you excited too.
Yes, sir.
Yeah, it's great. We're going to take a break. When we come back, we'll wrap up with Dr. Brown here at Iowa State's College of Veterinary Medicine.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
The cost of an open cow these days is very expensive. It's hard at times to dedicate a half a day or a whole day to leave your practice to go palpate cows. And so Alertis Test has helped speed the process up of getting preg rates back to the owners. And so free up time for diagnostics or working in your clinic. It also will help generate revenue, not being on site to do the testing.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson. I'm here with Dr. Justin Brown. We're at Iowa State University's College of Veterinary Medicine, where Dr. Brown serves as an assistant teaching professor, teaches classes, handling cases, doing research, all the above to help serve the swine industry and beyond. And I'm trying to pull him into the beef industry and help us set this program up because I think it's vital. And we talked about foreign animal disease, which we have, discussed foreign animal disease in the beef industry as well. But I really think there's some utility in getting proper diagnosis by having people that are certified samplers get the right case, the right samples from the right animal and sent in time for us to get some answers.
Sure. Absolutely.
I mean, you're dealing with it every day in the swine industry. Have you seen people take off from this, or?
Yeah, I think so. I mean, like I said, we have individuals that are on farm every day and a vet's not there every day, right? And so when something does pop up that we need samples collected for, if we can get them trained and they can collect those for us and get those submitted to the lab, I, as the vet, get the report from that and then can guide them through next steps or appropriate treatment or therapies that way. It really just helps kind of streamline the whole system, right?
I would think that, and then I'm assuming that you have like a digital reporting system from the diagnostic lab that you don't have to stand there and watch it. It's kicking it out and getting it to the right people on time. And with the diagnostics we have today, it's, it used to be you'd send in a chunk of lung, you'd get your results back in a week, and by then we either had success or failure. Or I guess if we're sending a chunk of lung, we already had failure. But if we're sending in nasal swabs or blood samples, but today with PCR, it's overnight.
Right. Yeah. And I can't speak for every lab, but I know here at Iowa State, typically, if samples are here before 11 a.m., you get same day results if that test is run that day.
That's amazing. Yeah. So when we start to think about getting people in the beef industry certified to take the right samples from the right animals to get them in, there's so many times that I think I'm working on a respiratory disease case and it's parasites. As high priced as we're paying $3 a pound now for calves to come in these feed yards. I think that not just implementing a vaccine or taking a vaccine out, but really working with somebody like Dr. Brown to get the right diagnosis and the right treatment plan and the right prevention plan is important.
Absolutely.
Y'all do it routinely in the swine industry, don't you?
It does. Yes, sir. Yep. Happens a lot.
Cool. Any last words on certified sampler and what you've seen from the program?
Yeah, I think there's been a lot of positive feedback from the industry and states that are enrolling it, right? A lot of people are excited about it. I'd love to see it spread to other species as well, because I think beef, poultry, we're all kind of working the same boat, right? Labors are one of our biggest issues, and being able to get out and sample, the more people that we can get certified, the better we're all going to be.
Awesome. Thanks for being on the show today.
Yeah, thank you for having me.
Thanks for watching the show. Remember, if you want to know more about us on DocTalk, you can find us at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thompson, here with Dr. Justin Brown, and we'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
I feel the use of genomics for cattle producers will be more widespread than we're seeing it now. I think we're just in the beginning stages of it. And I think a lot of people just see the side of the replacement females and increasing the predictability and future use of your females, because we all know the cost that it takes to develop those into a cow. The large side of it that folks miss out on is the use of genomics to predict the product that they're making every year, and in that I mean their calves. The feed yards are constantly after a more predictable product, a more predictable days on feed, a more predictable outcome on the rail. Through genomics, we're able to accomplish a lot faster what used to take multiple generations.
Identity Beef. Contact your Neogen territory manager to test today.